Good morning and welcome. My name is Patrick Gaskin. I have the honor and the pleasure to be the President and CEO of Cambridge Memorial Hospital. I'm very glad to see a full house here today for an important announcement. First of all, I should say to the Minister, I'm fighting a little bit of a cold, so if I get all teary-eyed and Kleenex to my nose, you could say you went to Cambridge and brought the CEO to tears. And I wouldn't regret that for 1 minute, to be perfectly honest. Minister Matthews, thank you for coming today, and welcome to our organization. Minister, you've had an opportunity, a quick tour to see some of our great staff and the great care that we provide to our community. And I am so proud to be part of this system, and I hope that we showed you and exuded that kind of care that we see for our community. I'm going to take a little bit of license being the MC, and I want to read to you a letter to the editor that was in Tuesday's paper that starts, and I'll just read an excerpt of it that says, "Thanks to CMH staff." And what the author said is, "Within 45 minutes of speaking to the first triage nurse, I had seen a nurse, a doctor, been given pain medication, a blood test, and started down the hall for the ultrasound. The whole 2-hour visit from start to finish was met with extremely helpful and surprising quick treatment. I want to thank the staff that morning who helped me make me feel comfortable and well taken care of." And Minister, that's what we do each and every day in this organization, and we're very proud to do that. Before I introduce John Malloy, who will introduce our Minister, I would like to just recognize some of the distinguished guests we have in the audience today. Regional Chair Ken Sealing, I believe, is here, there's Ken, thank you. Ken has been a great supporter. As you know, the region of Waterloo committed $37.3 million to the 3 hospitals in Waterloo region for their capital needs. That money has and will continue to support the hospitals and the great care that the hospitals provide, and we're indebted to the region for that. Mayor Craig, His Worship, Doug Craig is here as well. Similarly, the city has been a great supporter of this hospital, both in terms of financial support with $6 million set aside for our capital needs, and just moral support and encouragement for our hospital, and we appreciate that. Jerry Martiniak, our MPP for the Cambridge riding, could not be here today. Carol Ann Nugent is here on his behalf. Welcome, Carol Ann. Always great to have you here. And some of our health partners from the region as well that have attended today. Kathy Durst, the chair of the Waterloo-Wellington Local Health Integration Network. Kathy, great to have you here today. Bruce Lochner, the interim CEO from the Waterloo-Wellington Local Health Network. Again, thank you both for coming today. Don Shilton, the president from St. Mary's General Hospital, who offered to bring his vuvuzela today to today's event. I hope it's in the car, Don, not here. Thank you very much. Richard Ernst, the president and CEO from Guelph General Hospital. Richard, thank you very much for coming. Malcolm Maxwell, the president and CEO from Grand River Hospital. Malcolm, thank you for coming. Kevin Mercer, as well, the CEO for the Waterloo-Wellington CCAC. Kevin, thank you very much for coming. And John Bell, the former chair of our board of directors for Cambridge Memorial Hospital. John, great to have you here as well. Now I'd like to introduce John Malloy. John actually really needs no introduction. He's well known to the Cambridge community. John's been the MPP for Kitchener Centre since 2003. In 2007, he was appointed the Minister of Training Colleges and Universities. And when I met Minister Matthews at an event at St. Mary's last year, she introduced me to John as the Minister of Training Colleges and University and the Minister of Cambridge Memorial Hospital. And I thought that was an important title that I haven't seen John use since, but I use it all the time whenever I see him. John's been a strong advocate for healthcare in our community. We've seen huge developments under his leadership in terms of the mental health services at Freeport, the medical school, topping up the funding for that, family health teams coming. The list is endless, and we couldn't do without John's work. And John lives healthcare every day. As we know, he's married to an emergency room physician who practices in our community. So please join me in welcoming John to say a few words and introduce the Minister.
Patrick. Good morning, everyone. It's a great pleasure to be here today to help welcome Minister Matthews to our community. Not only is she going to make a very important announcement that I think is going to have a tremendous impact on Cambridge, but I think in the entire region, the entire LHIN, but she also explained to me what a vuvuzela was, because I had no idea when I asked her. I appreciated Patrick's very, very kind remarks, and obviously healthcare is a central preoccupation here in Waterloo Region, and we talk about the Lynn, Waterloo, Wellington, and I think all of us are very, very proud that we put together a system, an integrated system of our hospitals, of our community care providers, and that we really do have an outstanding healthcare system. And it's on that note that before introducing Deb, I just want to take a second and echo what was said in that letter to the editor, and offer thanks to everyone here today, from Cambridge Memorial Hospital, to all the staff, to the medical personnel, to the volunteers, for the outstanding work you do. Cambridge Memorial Hospital is a very important part of our healthcare network, and we want to thank you for the service that you provide. We don't say thank you enough, so be very, very proud of all that you've accomplished. And I think today's announcement is another sign of the confidence that we have in our healthcare system here in the region in general, and at Cambridge Memorial Hospital specifically. I have the pleasure of welcoming Deb Matthews here, of saying a few words of introduction. I think people are very aware of Deb's outstanding career on the provincial scene. She was elected, as I was, in 2003, and I think made her first mark province-wide in the area of poverty. She was parliamentary assistant to the Minister of Community and Social Services and did a lot of work. She was a constant visitor here to talk about poverty, to talk about those that were the less fortunate. And none of us were surprised in 2007 when she was asked to lead the Cabinet Committee on Poverty, of which I'm a member, as well as be Minister of Children and Youth Services. And her whole focus in terms of poverty, in terms of reaching out, has been about issues around prevention, about making sure that we have systems in place that support people, that provide easy access, to make sure that we have integration across the board. And I think she's taken that whole philosophy to her new role as Minister of Health, where she really does see the need to have a balanced system, one that looks at prevention, one that looks at community-based care, all in the name of supporting what goes on in our hospitals, which have a key role to play, but a partnership role. And as I say, she's here today to make a very exciting announcement about Cambridge Memorial Hospital and how they're going to be playing a further key role in both in Cambridge and in the community beyond. So Deb, we welcome you here to the hospital. We welcome you to our community. Ladies and gentlemen, please help me in welcoming Ontario's Minister of Health and Long-Term Care, the Honourable Deb Matthews.
Thank you so much, John. It's wonderful to see you. As John said, we were elected on the same day back in 2003. I think we were sworn into cabinet the same day in 2007. John and I sit close to each other in the legislature. He's right behind me, so I get updates from him on things related to his ministry, but also on things related to his little children. And it's wonderful to see John here today, and I'll get, hopefully before I leave, I'll see the latest pictures of his beautiful and growing family. I am absolutely delighted to be here. The first thing I want to say is reiterate what Patrick and what John have already said, and that is thank you. This is an excellent hospital doing excellent work, providing excellent care. And I want to say thank you, each and every one of you, for playing your part in ensuring that people in Cambridge and the area get access to the care that they need as quickly as possible, and with the care and the personal touch that you are so well known for. So thank you so much for the work you do. So you probably wonder why I'm here, and you probably want me to get right to the announcement, but I'm going to take just a minute to do a little preamble, just so I know you're all paying attention. We were elected in 2003. We inherited a healthcare system that was not providing the care that people needed on a number of areas. The two highest priorities we set for ourselves was to improve access to primary health care, make sure everybody had a family doctor. And that was a serious problem here. We've made terrific progress on that front, including right here in Cambridge, where we've got family health teams taking thousands of previously unattached patients. The other area where the healthcare system was not providing the kind of care that people in Ontario should expect to have was around wait times. People were waiting far, far, far too long for procedures. So we went to work, and the first thing we did is we identified 5 procedures where we wanted to start measuring and bringing down wait times. So we've gone from those 5 procedures, developing measurements for them, publicly reporting on how we're doing on wait times, and making strategic investments to bring those wait times down. On most of our indicators, and now we actually publicly report, check out Healthcare Options website, where you can just surf and find out how all the hospitals are doing and how all the LHINs are doing on every procedure that's done virtually. We've been able to make big progress and meet our targets on almost all of those procedures. One that has been particularly difficult, though, where we are not achieving the wait times that we think we need to achieve for the people of Ontario, is MRI wait times. We've made some good progress in this LHIN. In fact, we've made some extraordinary progress in this LHIN. We've gone from 3 years ago, people were waiting 268 days for an MRI procedure. That is simply not acceptable. We're now down to 66. So from 268 to 66 over 3 years is a significant improvement. But we want to do better. We've set ourselves a target of 28 days. So we need to enhance the capacity of MRIs. And I'm very, very pleased to tell you that Cambridge Memorial Hospital is going to be the home to a brand new MRI machine. So we're making this investment because we believe in Cambridge Memorial Hospital. We believe that you can do more than you're already doing. And what I'm learning is by having an MRI machine here on site is that you're going to be able to get people the care they need, the diagnosis, the treatment a lot more quickly. It means you're going to be able to keep patients here who otherwise might have had to have been transferred to another hospital in the area. So this is just one more step in improving the quality of care and improving and strengthening the role of this hospital in this community. So I want to say congratulations to all of you who have made this happen.
As many of you know me, I'm not one for many speeches. I'm quite shy, but Minister Matthews, words can't express how grateful we are for the announcement that you've made here today. And I think I speak on behalf of all physicians, and particularly my colleagues in the radiology department, how much of an impact this will have for the patients in our community here. As we were discussing during our tour of the department, MRI now is almost a standard of care in several areas of the body, and we were talking about neuroimaging and musculoskeletal imaging, where it's actually revolutionized those specialties. And in general hospitals like this, 70% of the imaging we do on MRI will be for those specialties. Another great thing why the MRI on site is it helps our inpatients, our critically ill patients. We have ICU beds here, and thereby we don't need to transfer these patients out, and the risk benefits there are clear to see for everybody. It's also becoming the standard of care for lots of other imaging, lots of other disease processes. In Canada and in the Western world per se, cancer imaging, cardiovascular imaging, and for strokes. They're 3 of the biggest causes of morbidity and mortality in the Western world, and MRI is helping to treat those conditions better, particularly in cancer imaging. We can stage a lot more accurately, and this helps the patient decide as well on what sort of treatment options are open to them, It helps in follow-up imaging because, you know, we all know someone who's had cancer and they want to know they're clear of disease. And MRI is one of the tools that can answer that question for them. As Chief of Diagnostic Imaging at this hospital, I've had the pleasure, actually I correct myself there, I've had the privilege of working with an exceptional team of young dynamic radiologists who are standing there and giving each other's high five and everything else out there. And as Mr. Phillips has met all of us, and he's quite right, we just can't express how grateful we are. We've been working on this proposal since we started, I think 2.5 years ago now. And so this is a culmination of a lot of hard work on the team's part. Just before I conclude, actually, I'm just going to make a comment off the cuff. I'd just like to express my sincere thanks to Patrick, actually, and his new team he's brought in, which many members are in here now. We've managed to work collaboratively, and we've making healthcare more accessible and more appropriate for the patients in this community. And with their help, we're also forming new links with other hospitals in this LIN to form a coherent healthcare service. And that's we're working on several projects for that at the moment. And without senior management, and obviously Patrick being the head of all that, without his cooperation, it'd be very difficult. And he sees the benefits in it. That's just off the cuff. Sorry. So, Minister Matthews, all I can say is thank you very much for coming down here and making this great announcement for us. If you have any other such announcements, we'll be happy to welcome you back again. Won't be a problem. Please do come down. But on behalf of myself, my team, my department, thank you very much.